Autism is described as a spectrum, but what does that really mean? I'm Dr. Mackenzie Salt, an assistant professor in the Department of Psychiatry and Behavioural Neuroscience at McMaster University, and I am autistic. Autism spectrum disorder, more commonly known as autism, is a neurodevelopmental condition that affects how people perceive and interact with the world. Autism is a condition that is commonly, but not always, identified in childhood, and it persists across the lifespan. It is more common in men and boys, but women and girls and gender-diverse people can be autistic as well. Autism is diagnosed based on restricted or repetitive behaviors and issues with social communication being present in childhood. The diagnosis is also classified based on the level of support the autistic person needs. Some common characteristics of autism include rigid adherence to routines, not meeting developmental milestones, and repetitive body movements that can help with processing stimuli, also known as stimming. Autism is referred to as a spectrum. This is because autism does not look the same in every autistic person. There's an expression in the autism community: when you've met one autistic person, you've met one autistic person. The specific set of characteristics or behaviors that an autistic person displays can vary from person to person. For example, one autistic person might be non-speaking, while another could talk to you at length about their favorite features of airplanes, and anything in between. Characteristics can also vary between autistics of different gender identities. The underlying challenges are the same, but how they appear can be different based on the person and the perspective of society. Autism can also look different across the lifespan. When diagnosed, school may be the main environment of social interaction outside of the home, but school is a very different environment than the workplace. The challenges may change as circumstances change. So the autism spectrum is not just linear, it is also intersectional. Communication can be a challenge for autistic people. Some autistics do not speak verbally, but they can communicate using alternative forms of communication, such as sign language, using picture boards, or a computer or tablet using text-to-speech software. For autistics who do speak verbally, they can take things very literally and have trouble with metaphors and sarcasm. They may also repeat things that they have heard, and it is very common for autistic people and non-autistic people to misunderstand each other. Autistics can also have difficulties reading body language and making eye contact. It is common for autistic people to have difficulties with processing sensory information. This means that some individuals may have challenges wearing or touching certain fabrics, getting their hair cut, or eating certain foods. Others can be overly sensitive to sounds or noises. These are all highly individual to the person, and every autistic person is different. There are also some things that autistic people are very good at. Some autistic people can have very good long-term memories and have a great memory for facts. Many autistic people tend to think very logically and pay great attention to detail, which can be a boon in certain fields. They tend to be very good at pattern recognition, analytical thinking, and research. In addition, many autistic people also have a strong sense of justice and morality, along with a knack for thinking outside the box. When thinking about how to support autistic people in your life, you should talk to them. Because autism is a spectrum, it is important to focus on the individual person. Ask them or their caregiver what their needs are, or what things they are finding most challenging, and then work with them to come up with ways that you can support them. Every autistic person is unique in their characteristics and their needs.